And February is Heart Health Month, and with cardiovascular disease, including heart disease and stroke, it is the leading cause of death in the United States. So these are some really important reminders. To learn more, we turn to UofL Health's Dr. Henry Sadlow. He has a lot of experience with this, and we know you today are going to tell us about this test, this very specialized scan that can show someone that something might not be right. So let's start with these coronary calcium scans and who should be getting them.
Yes, this is a basic non-invasive CAT scan with no IVs, no injections, the same amount of radiation as a mammogram that can be done. We do it at University of Louisville at the radiology department. But it's non-invasive and it gives you great information whether you have no plaque, mild plaque, moderate plaque, or extensive calcific coronary plaque.
And who are you suggesting talk to their doctor about these scans?
Well, so all you need to do is talk to a primary care provider, and we use 5 things: hypertension, diabetes, hypercholesterolemia, smoking, and most importantly, family history. Now, you don't have to have all those. Even someone with 1 or 2 of those may be a candidate. Men over 40, women over 45. Women get a little bit of a break with estrogens. They don't develop coronary disease till later.
Okay, and so what's the process like if you do get the scan, and then once you get the scores back, what can you learn from it?
Okay, so there's 2 types of plaque. The calcified plaque, we identify all of it. And then if someone has abnormal score of anything other than 0, all patients need to be on a statin. They need to watch their diet. If your score is over 100, you probably need an aspirin if you don't have bleeding problems. And if your score is over 400, we talk about doing a stress test. Or if you have any symptoms plus the calcified plaque, that would be a very important reason to do some type of test to see if you need a stent, bypass surgery, or just medications.
You can learn a lot from these scans, you can tell. Okay, so one question I've got to ask you before we let you go. What are some basic heart health tips you have for people who may not be far enough along to be worried about the scans, but just things you can do to make sure you're keeping everything healthy?
So a lot of this we already know, but we just need to emphasize it to our patients. I try to do this in the office. Get 150 minutes per week of moderate intensity aerobics. Brisk walking will do that, or any other thing you like. Eat healthy, drift towards a vegetarian diet. Our new chairman of medicine is vegan, and he's going to lead us into some new ideas on this. And then make sure you report any symptoms to your primary care provider or cardiologist.
Excellent. Thank you so much for taking the time, Dr. Sadlow.
Thank you. Hopefully we can save someone from a heart attack.
I think absolutely. This is really important work. Thank you
Thank you for
so
having
much.
Me. Thank you.